Welcome to this training on Clostridioides difficile, commonly known as C. difficile or C. diff. Today we'll review what C. difficile is, common signs and symptoms, why it is important from an infection prevention perspective, current isolation considerations, and key MDS coding reminders. So what is C. difficile? C. difficile is a bacterial infection that affects the colon. It often occurs after antibiotic use and can cause inflammation of the intestines and severe diarrhea. One reason C. difficile is so concerning is that it produces spores. These spores can survive on environmental surfaces for extended periods of time and may contribute to the spread of infection in healthcare settings. What signs and symptoms might we see? Residents with C. difficile commonly experience frequent watery diarrhea, abdominal pain or cramping, nausea, loss of appetite, or fever. Some residents may also have laboratory findings such as an elevated white blood cell count. Prompt recognition of these signs and symptoms is important because early identification may help reduce transmission and support timely treatment. So why is C. difficile important? C. difficile is highly transmissible because its spores can survive on environmental surfaces for prolonged periods. Without appropriate infection prevention measures, these spores may spread to other residents, staff, or equipment. In addition to the risk of transmission, C. difficile can lead to dehydration, hospitalization, and other serious complications. This is why diligent infection prevention practices are so important. The CDC has emphasized that C. difficile is highly contagious and that spores can survive on environmental surfaces, contributing to transmission. Because of this, residents with suspected or confirmed C. difficile infection should be placed on contact precautions. Staff should use gowns and gloves upon room entry, and hand washing with soap and water is preferred after caring for residents with C. difficile. The CDC's guidance also emphasizes maintaining these precautions until at least 48 hours after diarrhea has resolved. Let's review the 4 requirements for coding. Isolation in MDS Section O0100M. First, the resident must have an active infectious disease. Second, transmission-based precautions must be in effect. Third, the resident must be in a room alone because of the active infection and cannot have a roommate. And fourth, the resident must remain in the room with services brought to the resident rather than the resident leaving the room for services. All 4 requirements must be met in order to code isolation on the MDS. Remember, a resident may appropriately be placed on contact precautions when C. difficile is suspected. However, MDS isolation coding requires confirmation of an active infectious disease, such as positive testing and clinical symptoms, as well as all 4 coding criteria to be met. As a final takeaway, remember that C. difficile is highly transmissible and requires prompt infection prevention measures. The CDC recommends contact precautions for suspected or confirmed C. difficile infection. For MDS isolation coding, the infection must be confirmed and all 4 coding criteria must be met. If documentation is unclear, additional provider clarification may be appropriate. Thank you for participating in this training. This concludes our presentation.